Hello, everyone, and welcome to the start of season 4 for Ask Miss Jai Live. I am so grateful that you are joining me today for this conversation on trans and non-binary healthcare while incarcerated. I think it's timely for us to be having these conversations. I'm going to be talking to you a little bit about what folks have been saying, what we know in the research around incarceration for trans and non-binary folks, as well as the experiences in incarceration and access to healthcare. I'll be sharing a little bit about my own experiences working as someone who did case management for folks who were both incarcerated and non-incarcerated around HIV and what linkage and access to care looks like for those, for a chronic health condition. And for folks. And I'll be talking a little bit about just the ethical considerations and what it means for us to care for folks who are engaged in the incarceration system in jails, prisons, and in detention. So I'm grateful that you're here to join today. If you are catching this live, please put a hashtag live in the chat. If you're catching it on the replay, go ahead and put a hashtag replay. I am looking forward to where we will go today, and I'm excited for season 4 of Ask Miss Jai Live. Also, please, if this is helpful information, please feel free to share it with your colleagues. Please subscribe to the YouTube channel. And please check out some of our previous videos as well. We have 3 seasons, over 30 videos dedicated to different aspects of trans and non-binary health. So let's get started with talking about trans health in incarceration today. So part of the reason that we're discussing this is because it keeps coming up in the media, especially because it is around election time as well, that there is this perspective that gender-affirming surgeries are just being doled out in prisons, and that folks who are incarcerated are somehow getting access to medical care that non-incarcerated folks don't have, and that it is this large burden on financial budgets for the country. And so we're going to be talking a little bit about what this actually looks like, and also what some of the major organizations say about the ways that we should be serving and treating folks who are incarcerated, because folks who are incarcerated also have health conditions that need to be addressed. So according to the American Academy of Family Physicians, incarcerated individuals and those detained in immigration facilities are disproportionately affected by chronic health conditions and tend to receive inadequate health care before, during, and after incarceration or detention, which further impacts health outcomes. We also know that the United States is one of the largest countries for incarcerating people in the world, and that we are seeing an aging population, that folks are growing old in incarceration as well, and that can bring about its own health conditions additionally. So we know that the health is generally poorer for folks who are incarcerated, and we know that that before incarceration, during incarceration, and after incarceration, that access to adequate and equitable healthcare is not really available for folks, or there's challenges with linkages to care. And physicians, clinicians, the medical community have an ethical responsibility of care for patients in an equivalent way to those who are both incarcerated and non-incarcerated, meaning that if I have diabetes and I'm incarcerated, my clinician, the clinician that I'm seeing, has an ethical responsibility to provide me with the equivalent level of care that they would provide to other patients of theirs that are non-incarcerated and also have diabetes. So there's this ethical necessity for clinicians to provide equitable care to the patients that they are seeing who are incarcerated. But we know that the ability to access care for folks who are incarcerated is challenging in and of itself. We know that it's difficult for anybody, not just trans and non-binary folks. So we're not even talking about gender affirming care right now, but we know it's difficult for anybody to access care when they are incarcerated. And that's in part because of challenges with the way that it's systemically set up. So for example, the Prison Policy Initiative shared information about the cost of care, and that cost of care can be prohibitive. So folks who are incarcerated still have to pay co-payments for their medical care, anywhere from $2 to $5 for a co-payment. However, folks who are incarcerated only make 14 cents to 63 cents per hour to go into the fund that they have. So it's the equivalent of asking someone who's not incarcerated to pay hundreds of dollars in a copayment just to see a physician. So we know that it becomes a barrier to care, like the cost becomes a barrier to care. We know that that clinicians are not always available, or that the actual infrastructure of incarceration does not connect folks up to adequate medical professionals. For example, when I was working as a case manager at an HIV clinic and we were working with incarcerated patients, there were challenges with getting our patients on the phone for telehealth. There were challenges with getting our patients to the actual visits as well. And these are folks who are, for all intents and purposes, have like their schedule determined for them. So when we have these challenges with actually getting folks in for their care, then that becomes another access or barrier access to care as well. So we know there's a financial component to it, which we often don't think about when we think about folks who are incarcerated, but there's a financial component to it. We also know that there is a component of just a lack of access and the lack of resources that are made available to folks who are incarcerated around their health. But now I want to talk about trans health specifically. So the U.S. Trans Survey 2015, which is currently the largest survey we have about the health experiences of trans and non-binary people nationwide, and also the closest thing we have to population level data. But the U.S. Trans Survey 2015 found that incarceration and folks, trans and non-binary people who are incarcerated, experience additional safety issues. So again, we're not talking about gender affirming care yet. We're still just talking about the experiences. So 1 in 5 trans and non-binary people report being physically assaulted by staff. 1 in 10 report being sexually assaulted by staff. The numbers go up when we look at the experiences of physical and sexual assault by other inmates as well. With almost, and for the folks who experience that kind of assault from staff, almost 1 in 4 of those who experience that assault in the last year experienced it 8 or more times. So we know that it's also happening a lot and consistently to the same folks, to our trans and non-binary siblings. There was also a 2020 scoping review from Marie Claire von Hout. I apologize if I'm mispronouncing the name, from Stephanie Kelly and from Allison Hillis, that found that that looked at 2009 to 2019 research globally on the experiences of trans and non-binary people in incarceration, and found that restricting or preventing access to care meant there were a number of additional challenges for trans and non-binary folks. So, for example, incarcerated trans people have challenges with accessing access to gender dysphoria evaluation or diagnosis. And there are some challenges with the diagnosis process as well. So the DSM moved from diagnosing trans identity to instead diagnosing gender dysphoria, because we're not trying to treat an identity, we're trying to treat the underlying experience of dysphoria, that intense discomfort and stress that comes about for someone when their gender identity does not match their sex assigned at birth, does not match their physical body. So trying to treat that gender dysphoria, but the actual experience of trying to get that evaluation or diagnosis while incarcerated is incredibly difficult because of challenges with actually connecting folks up to the professionals who can provide that diagnosis or conduct that evaluation, the challenges with resourcing for those services, the challenges with folks remaining closeted while incarcerated because of fear of discrimination and stigma, and the actual experiences of physical and sexual harm that happens to our community while we are incarcerated. So that's one of the big challenges that comes up when it comes to the healthcare of trans and non-binary people who are incarcerated. Another is that there's not consistency in receiving gender affirming care. So the Principle 12 of the National Commission on Correctional Healthcare released a position statement, which stated that trans people on hormone therapy prior to incarceration, whether with a prescription or not, should have their hormones continued pending evaluation by a specialist, unless there is some medical emergency to determine why those hormones are being stopped. because we know that if someone is on gender affirming hormone therapy and then they are taken off of it or it's discontinued, then there can be challenges physically to our bodies. So for folks who are on estrogen, if they're suddenly stopped that estrogen and those testosterone blockers, then they might experience menopause-like symptoms. For folks who are on testosterone and are stopped, they might experience fatigue and like all of these physical symptoms from the changes in hormone therapy and the hormones that are present in their body. So we know that there are physical health conditions and health concerns that can come up when we discontinue gender affirming hormone therapy. But we also know that there are mental health concerns that come up when discontinuing gender affirming hormone therapy. So the standard of care is that we continue that gender affirming hormone or blocker or whatever is currently going on when the person becomes incarcerated. However, we also know that that most states do not support access to gender affirming hormone therapy or continuation rather of gender affirming hormone therapy or provide gender affirming surgeries. There are only, when I last looked, 8 states that provide specifically outline providing gender affirming surgeries. But we know that just saying that they provide it doesn't mean that that's actually the reality, because continuity of care is often inconsistent for many health conditions because of things like out of stock medications, transferring to different wings, intermittent dosings. So we know that access to gender affirming hormone therapy is still has barriers when folks are incarcerated, even when they had started gender affirming hormone therapy prior to incarceration. We also know that access to gender affirming hormone therapy while incarcerated, as I mentioned before, is difficult because of things like if someone is seeking a new diagnosis for gender dysphoria, there might not be evaluators or assessment available. If folks are unable to get that diagnosis, they might not be able to start gender affirming hormone therapy, and then there might be additional restrictions in getting that gender affirming hormone therapy as well, depending on the state that they're in. When I talk about gender affirming surgery specifically, so this is the one that comes up for a lot of folks. This is the one that the media really likes to hold on to, is gender affirming surgeries, because they're like, gender affirming surgeries, there must be, like, why is this happening to folks, right? I want to make it really clear, gender affirming surgery is not readily available in prison systems. It's not readily available in detention systems or in incarceration because of the challenges that incarcerated people face. I mentioned some of the barriers that already exist, right? Access to medical care is already challenging enough because of financial barriers and because of the barriers of consistency and the reality that overall we in the United States don't care for incarcerated people on an equitable or equivalent level that we do non-incarcerated people. And so when we think about it that way, we also know that trans and non-binary people who are non-incarcerated have challenges getting their gender affirming hormone therapy and challenges with getting gender affirming surgeries for a variety of reasons. And so most of them related to socioeconomic reasons, related to the ability to have health insurance, the ability to have employment, to be able to afford the cost, to be able to find someone who is knowledgeable and adequate, to be able to find a clinician who knows how to treat trans and non-binary folks, right? So all of these issues that non-incarcerated trans and non-binary people experience are compounded for incarcerated trans and non-binary people. So gender affirming surgery is not readily available in prison systems because we know that there are challenges with incarcerated people showing symptoms or talking about gender dysphoria. Lots of trans people might recloset when they're incarcerated for fear of discrimination or experiences of discrimination, or to prevent stigma, or to prevent, as I mentioned already, physical or sexual violence. So to prevent all of those things, folks might not show symptoms of gender dysphoria or express those externally or bring them up. That there are questions about the ability for incarcerated people to get all information about a medical procedure and make a fully fully informed consensual choice around a medical procedure. And so that becomes tricky in order to get full consent for gender affirming surgery. It's also difficult for folks who are incarcerated to potentially demonstrate control over comorbidities that would need to be addressed prior to a gender affirming surgery, because we're also in this environment where there's a lot that's happening externally to us that might be exacerbating comorbidities, especially around mental health for us, right? If we are in an environment where we are fully controlled, where we are fully being monitored and policed, because that is the nature of an incarceration space, then that might be exacerbating comorbidities that are difficult to show full control or to demonstrate control over in order to be approved for gender affirming surgery. And part of it for a lot of folks is being able to show evidence of living as your identified gender for 12 months. And for a lot of folks who are incarcerated, they're incarcerated by gender, and they're incarcerated by their sex assigned at birth, or what is on their legal documentation. And so it might be difficult for folks to show that they've been living as their identified gender for the last 12 months if they've been incarcerated for the last 12 months in a prison system that does not align with their gender identity. So because of this, there are all these additional barriers that exist for trans and non-binary people to even get not only gender affirming hormone therapy, but gender affirming surgeries. But this is part of a much larger conversation, which is that we don't provide adequate health services, and we don't take care of folks who are incarcerated in order to address chronic health conditions, in order to address the ongoing health concerns. And so the bigger conversation that really we should be having out of this is, how can we better care for the folks who are currently incarcerated, and what is the responsibility of correctional facilities to care for the population that they are responsible for? Because again, drawing from my experience of working in HIV, there were not only challenges with getting folks their medication, getting correct dosages, making sure that folks didn't have a break from prior to incarceration to when they were incarcerated in their antiretroviral medications. So there were all these challenges that were happening when folks were incarcerated, where they weren't able to get their medications. They were going on and off of their antiretroviral medications. And there were a lot of challenges with continuing that care. So that's like the lead up. I also chatted and worked with some nurse practitioners who worked in correctional facilities and were having challenges with even meeting up with their patients in order to adequately assess if they had been on antiretroviral therapy previously, what that antiretroviral therapy was, so that they could continue it. And so there were all these breaks in care happening, which we know for HIV specifically can cause all sorts of challenges with the person's health. So seeing all of these breaks happen prior and during incarceration, but then on the back end of that, when folks were leaving incarceration, a lack of linkage to care in order to continue medical care, a lack of providing the opportunities and connecting folks to some of these other socioeconomic challenges that create barriers to care, that create recidivism and keep people locked in the incarceration cycle. So folks would go on and off their medications at that and have breaks during that moment as well. And so we see the same thing happening for gender affirming hormone therapy and for trans and non-binary folks. So I think it is incredibly short-sighted for us to sort of paint with a broad brush that, well, anyone who's trans or non-binary, when they go into an incarceration space, are just getting free-for-all hormone therapies and gender affirming surgeries, and it's all on the taxpayer dollar, because we know that that's not the case. And we know that healthcare within the incarceration system in general is subpar and is not treating the people that we are responsible for, and that correctional facilities are responsible for. And if you want to see a more recent example of that, we can look at the ways that correctional facilities and incarceration spaces treated folks who were detained and who were incarcerated during the COVID-19 pandemic, and how there was a lack of access to adequate care, a lack of access to the standardized procedures that would prevent folks from spreading illness amongst the community. So we see kind of this like step and repeat over and over. So when we talk about trans and non-binary healthcare while incarcerated, I have a couple of key takeaways for you. The first is that we know that healthcare in general for folks who are incarcerated is subpar and is not adequately serving or adequately meeting the health needs of people who are incarcerated. The second is that gender-affirming hormone therapy, that the best practice around that and what is recommended is that if someone is on gender-affirming hormone therapy, that is, whether it's prescribed or not, that it is continued when the person becomes incarcerated, pending a evaluation by an expert, by someone who is trained in gender-affirming hormone therapy, unless there is a medical emergency that requires that to stop. And that the reality is that we are just not seeing gender-affirming surgeries and even access to gender-affirming hormone therapy as prevalently as we are actually talking about it. So it's distracting us from the larger conversation, which is that there needs to be an overhaul of healthcare services for folks who are incarcerated, and really an overhaul of gender-affirming healthcare for folks who are incarcerated and non-incarcerated. So I hope that this has been helpful. I hope that it has shed some light on kind of what's going on. I really highly encourage you check out the 2020 scoping review from Marie Claire Van Hout, Stephanie Kelly, and Allison Hillis. It provided a lot of information that even pieces I was unaware of. And I also really encourage you check out the U.S. Trans Survey 2015 and the early insights from the U.S. Trans Survey 2020, which doesn't currently have any information about incarceration, but they're in the process of doing a much more extensive analysis of the data. So I hope this has been helpful. If you enjoyed this, please share this, or if it helped to educate you about something, please feel free to share this with your colleagues and with other folks that you think could benefit from understanding more about trans and non-binary healthcare while incarcerated. Again, my name is Miss Jai. I run Ask Miss Jai Live. This is the kickoff for season 4. So I'm going to be going to be joining live every Friday to talk about a different health topic as it relates to trans and non-binary healthcare. Please like and subscribe so that you can get updates on those. And until next time, thank you for investing in the health and well-being of trans and non-binary people, and for being interested in our health and well-being.